Welcome to the Child Care Safety First Overdose Recognition and Reversal Training for Child Care Center staff. Today, we're talking about something critical: harmful substance contamination inside child care centers and overdose recognition and reversal. This training is designed specifically for child care staff because knowing how to respond in an emergency can save lives. We'll walk through what an overdose looks like, how to act quickly, and ways to prevent these incidents, especially for children and youth. At the end of this training, you should have grown enough knowledge to be proactive in case of an emergency. When the video is concluded, you will be given a short 10-question quiz. Answer 8 of the 10 correctly and receive a certificate of completion. Thank you for taking the time to equip yourself with the knowledge needed to be ready in case of an emergency. A opioid or drug-induced overdose. Overdoses can happen to anyone, including youth and kids. Whether it's accidental ingestion, exposure to unsafe environments, or experimenting with substances, being prepared is key. Acting fast can mean the difference between life and death. Today, we'll cover signs to look for, how to use life-saving tools like naloxone, also known as Narcan, and ways to support someone who has experienced an overdose. What is an overdose? An overdose happens when too much of a substance overwhelms the body and causes serious harm. The most common substances linked to overdoses are opioids like painkillers, heroin, and fentanyl, as well as stimulants and sedatives. According to Centers for Disease Control and Prevention, Narcan is safe to give to people of all ages, from infants to elder adults. And this includes a child who may have accidentally taken an opioid substance. Please refer to CDC website for more information. Overdoses among children and youth can be a serious concern in childcare settings for several reasons. While childcare centers are designed to be safe environments, certain risks can still arise. Here's how the problem can be linked to childcare centers. 1. Accidental ingestion. Young children are naturally curious, and they often explore their surroundings by putting things in their mouths. This can lead to accidental ingestion of dangerous substances. Medications left within reach, painkillers, sedatives, stimulants. Household chemicals disguised as food or drinks. Illicit substances brought in by visitors or even unknowingly by a parent or caregiver. Even a small amount of some medications, especially opioids, can be fatal for children. 2. Exposure to contaminated items. Baby bottles, blankets, and toys exposed at the home setting, coming in and contaminating the childcare environment. Fentanyl-laced objects. Some illicit drugs, including fentanyl, can be absorbed through the skin or accidentally inhaled. Poisoned or tainted snacks, drinks. Some children may come into contact with edibles, candies, drinks that contain THC or other harmful substances, either unintentionally or due to exposure in their home environment. This risk increases if children bring snacks from outside or if older youth sneak in unsafe substances. 3. Parental or caregiver influence. Children in childcare settings may be unknowingly affected by substance use in their home environment. They may have access to medications or illicit substances at home. Exhibit overdose symptoms upon arrival: fatigue, confusion, difficulty breathing. Bring unsafe substances to the childcare center without realizing the danger. 4. Older youth experimentation. For childcare facilities that serve older youth or after-school programs, there's an additional risk of substance experimentation. Teenagers may try prescription drugs without knowing the dosage dangers. Be unaware of the risks of mixing substances. Use drugs containing fentanyl without knowing they're laced. 5. Emergency response challenges. Childcare staff may not always be trained to recognize overdose symptoms. Additionally, centers may not have Narcan on hand to reverse opioid overdoses. Staff may mistake overdose symptoms for another medical emergency. Response time may be delayed, especially if the center is unsure whether to call emergency services. Signs of an overdose. Welcome to the most critical part of the training session. Recognizing the signs of an overdose. Whether it's an adult, a teenager, or a child, knowing what to look for and how to respond can save a life. First, let's understand something important. Every drug affects the body differently. That means that overdose symptoms can vary, depending on the substance involved. Let's break it down into 3 key categories. Opioid overdoses, stimulant overdoses, and specific signs to watch for in children and teens. Signs of an opioid overdose include very slow or irregular breathing or no breathing at all, blue lips or fingertips due to lack of oxygen, pinpoint pupils extremely small and unresponsive, weak pulse or unresponsiveness. If someone overdoses on opioids, they might appear unconscious. They won't wake up, even if you shake them or call their name. In this situation, every second matters. Acting quickly can mean the difference between life and death. Check for responsiveness, call their name, shake their shoulder. Call 911 immediately, don't assume they will sleep it off. If it's an opioid overdose, administer Narcan, if available. Perform CPR or rescue breathing if they are not breathing. Stay with the person until help arrives. Overdose deaths can be prevented, but only if you know what to do and act quickly. Being informed means being ready. How childcare centers can prevent overdoses. Secure all medications. Ensure that no adult or child has easy access to any substance that could be dangerous. Supervise snacks and drinks. Keep an eye on any outside food that children bring. Recognize overdose symptoms early. Know when a child is acting strangely and intervene quickly. Stock Narcan. Some states allow schools and childcare facilities to carry Narcan for emergency overdose reversal. Educate caregivers and staff. Make sure everyone knows what to do if they suspect a child or youth has been exposed to dangerous substances. Administering Narcan. One of the most effective tools for opioid overdoses is Narcan. This medication reverses an overdose by blocking opioids in the brain. How to use Narcan nasal spray. Lay patient on their back. Tilt their head back. Spray 1 dose into a nostril. Wait 2 to 3 minutes. If they don't wake up, give a second dose. Stay with them and monitor their breathing. Narcan only works for opioid overdoses, not stimulants or alcohol, but it can bring someone back from the brink of death. Stimulant overdose. Now, let's talk about stimulant overdoses. Stimulants include drugs like cocaine, methamphetamine, or even excessive amounts of ADHD medication. These drugs speed up the body's functions, including heart rate and brain activity. But when too much is taken, it can push the body into overdrive, leading to dangerous reactions. Common symptoms of a stimulant overdose include a dangerously fast heart rate, which can lead to a heart attack. Seizures, the body may shake uncontrollably. Extreme agitation, the person may seem panicked, paranoid, or unable to focus. High body temperature, they may be sweating profusely and overheated. Unlike opioids, stimulant overdoses don't slow breathing down, they speed everything up. That's why responding quickly is just as important. If someone has these symptoms and seems out of control, call 911 immediately. Overdose symptoms in children and teens. Now, let's focus on something especially relevant to childcare centers. Recognizing overdose signs in children and youth. Young children may be exposed to dangerous substances accidentally. They might ingest medication left within reach, take something they found at home, or be given tainted food or drinks. In older youth, overdose can happen from experimentation or exposure in unsafe environments. Watch for these key warning signs in children and teenagers. Confusion, they seem disoriented, unable to speak clearly. Dizziness or sudden loss of balance. Vomiting, especially if it happens suddenly. Difficulty breathing, short, uneven, or labored breaths. Unresponsiveness if they suddenly collapse or lose consciousness. Children and teens may not always be able to tell you they're in danger. That's why it's critical to recognize these signs early. If you see these symptoms and suspect an overdose, do not wait, take action immediately. The most important rule: act fast. Overdose symptoms can happen suddenly or develop over time. But no matter the cause, the response should always be the same. Act fast. CPR and rescue breathing. If they aren't breathing, you may need to perform CPR. Chest compressions. Press hard in the center of their chest, about 100 compressions per minute. Rescue breathing. If trained, give 2 breaths after every 30 compressions. Even if you're unsure, follow the instructions of the 911 dispatcher, they will guide you. Prevention strategies. Preventing overdoses starts with education and awareness. For youth and kids. Store medications safely, keep them locked away. Teach children not to touch unknown pills or candy, some substances are disguised. Make sure caregivers understand the risks, especially of fentanyl and accidental poisoning. Supporting recovery. After an overdose, medical help is just the first step. Recovery is a process, and those affected need support. Encourage them to seek professional help. Connect them to local recovery services. Most importantly, avoid judgment. Stigma prevents people from asking for help. Be the support system they need. Overdoses can happen to anyone. Acting quickly saves lives. By recognizing the signs, using tools like Narcan, and staying informed, you can make a difference. Remember, in case of an emergency, call 911 immediately. Keep the person breathing and conscious if possible. Administer Narcan for opioid overdoses. Encourage prevention strategies. Offer support without judgment. If you or somebody you know needs help with opioids and substance use disorder, please find help today. Help is always available at 988. Thank you for being part of this specialized training session. Protecting our youth is protecting our most valuable asset. Your knowledge and preparedness could save a life. Childcare safety first. Overdose awareness program.